Assalamu alaikum and good evening, everyone. Welcome to today's session. I'm Zainat Tabassum, currently studying in fourth year. I'm an associate of Journal Club, and I will be hosting this insightful discussion today. We're really excited to have you all as we explore how case-based approaches enhances our medical education and clinical decision making. So before we begin, I'd like to extend a special thanks to the learning department for their effort in gathering this case and making this session possible. It's now my pleasure to introduce our esteemed speaker, Daim Javed. Daim is the Vice President of the Rashid Latif Research Society and has an extensive research background with 6 publications and 10 abstracts presented at local and international conferences. With this expertise, today's session promises to be highly informative and engaging. So without further ado, I will now hand it over to Daim to lead the session. You have the floor.
All right, thank you so much, Muzaina, if that's the right pronunciation. My pardon. Anyways, everybody. So, firstly, Assalamu alaikum, and yes, I am Daim, and today, the major reason why I've been summoned by the entire team is to give a very good perspective on how we could integrate different clinical cases that we come across in a clinical setting, may it be in a surgical setting or may it be in a normal medicine department during our everyday OPTs or OBDs, or maybe in inpatient setting, how we come up across several cases that we find unique, we find exciting, and how can we utilize them and put them into present them in a clinical case report and publish them. So it is very important to understand and integrate both sides of clinical knowledge, and at the same time do an intensive literature review and add to the existing literature that is out there. So firstly, we're gonna begin with let me just share my screen. So everyone, so firstly, we're gonna talk about how we're gonna place today. I've been given a case by the learning department, and today we're gonna take that as an example of how we can end up utilizing the information presented in it and utilize it in order to end up writing a case report and end up doing a presentation out of it. So firstly, we're going to start off and firstly understand what exactly are case reports about. So a case report is a detailed narrative of a unique, rare clinical case. It not only serves as an educational tool, but also highlights an unusual presentation or complication. It also not only enhances the existing medical literature by documenting some insights that could spark further research. So in layman terms, if we talk about specifically, case reports are just coming up and writing a manuscript or reporting whatever is be or whatever unique case you found in a clinical setting. A lot of the times we come across different scenarios in which we find certain anomalies, may it be in patients, may it be in the treatment procedures, may it be in the interventions. And a major misconception about case reports are that case reports specifically need to be about a disease. Not necessarily. Sometimes case reports are about a specific intervention that was done. For example, someone ends up doing a laparoscopic surgery, and it end up enhancing the case in a very impacting the case in a very different way. That would also end up being a case report. So there are different aspects to case reports, but we'll be discussing the journal part of how a case report is being done today. But I'll be also adding on how different type of case reports can be potentially done in this entire time. Starting off, we're going to just have a case overview of the case that is being presented. So there's a patient which is 12-year-old, unmarried female, and the major chief complaints that they have presented with are intermittent bleeding from the nose and the ears, and this has been going on for the past 1 month. And despite generalized weakness, there is black discoloration of the right ear and nose for the past 10 days, and there is intermittent undocumented fever. Usually, the case overview is a generic history of the past patient that is being presented. Usually, whenever we are getting the data for the case reports, we're collecting data for the case reports. It is not. It needs to be verified, and for by verified, I mean the person who is taking the history must at least be a medical professional. Something that most high-end journals don't like is if medical students are taking the history, but even if they have taken it, is still considered, it is still accepted. However, if a house officer or anyone superior to it, may it be a PG, may it be an attending, may it be a doctor, they would all be considered as a viable source of the person who has been taking the entire history. Because because whenever you are reporting a case, even each and every detail in a history matters a lot in order to come to a substantial resolution or when we are writing the discussion in the later aspect. So you can see the clinical case at this point of time. It's a 12-year-old unmarried female, a young girl who has bleeding from the nose and the ears, and we can also see how her eyes and the nose have black discoloration at this point of time. And there is also certain bit of fever, but it's undocumented. It is like partial at times. It comes and goes. Now, a bit more on the patient history and clinical presentation. Right now, whatever I'm explaining are the stuff that you collect as data. So if today, we have got different people in this entire session, I would want the session to be more interactive. So just let me just take two random names out of this. For example, we've got Sarah, we have got Harim, we have got Aisha. So just take example of these three people. These three people have decided today that they want to, end up doing the case report, and for that they want to collect data. So they find a case, and now they have to first start off, as I initially told, with the patient history and the clinical presentation. So firstly, they'll get the history from the attendant. Next up, they will see the history that they've got. As for example, in this case is sudden onset. We've clearly talked about gradual worsening of the generalized weakness. Then we have got the development of the black discoloration, even the slightest of bit of aspects like the development. Initially we knew that it was black discoloration, but it is gradually increasing. That also plays a significant role in the entire report later on. However, even we have also talked about how the intermediate fever was being relieved by the antipyretics, and how rigorous, and there was no rigorous chills. Also, the personal history of the patient clearly says that they don't have a significant surgical history. They have decreased sleep and appetite. The bowel habits are normalized. The allergics are not known, and the family history is non-significant, and there is no specific TB contact. All right. So next up, we're going to talk about how physical examination and vitals play a significant role, because at times when you are trying to interpret a case, whenever you're reading a case report on the internet, you tend to go through physical examination and vitals specifically, because as you know, a lot of you might also be considering the USMLE exam. Even if not that, any exam, may it be the FCPS exam, may it be the PLAB exam or AMC exams, all of the exams today, or any exam that is related to medicine, we tend to come across vitals. So vitals play a very significant roles in interpreting the case in the end. So therefore, vitals play a significant role. So getting the right set of vitals, and at times people tend to have different set of vitals that do not match the criteria of the specific case report. So that is also a major reason why the case report gets rejected. So the data collection aspect needs to be very spot on, and you have to ensure that even if you believe that there is a certain gap, there is कुछ चीजें रहती हैं, कुछ आपके पास नहीं है in the exam, in the vitals. So you have to go back and try to get that again, try to collect the data, because if you have uh, if you have your data that is incomplete, your data is somewhat not at the par of an international case report, then there's a high chance that it might get rejected. Next up, you can clearly see in this specific case we have 120 to 70 blood pressure of the patient, followed up by a 91 pulse, which is kind of high. We also have the temperature, which is kind of febrile, and the O2 stat clearly shows 98.7%, which is also kind of normal. Even and then we can see the subvitals, such as that person is positive for anemia. There is no jaundice, clubbing, or cyanosis, or lymphadenopathy, or JVP. But we can also see that the systemic examination shows that there was, in the CNS, it was alert and orientation. In the chest, it was clear bilaterally, and for abdomen, the patient had soft, non-tender, no viscomegaly. And when we talked about the CVS systemic examination, we can see the heart sounds were kind of normal. But at the same times, you can see how whenever we're collecting the data, we have to go through all the systems, all the major vitals and subvitals, because they, as I clearly stated, they are very important role in order to end up doing the interpretation of why this case report is unique. Next up, we're going to go through the laboratory and imaging findings. So you can see that for this, we will go through all the reports that we'll be collecting. So if I talk about my personal experience and from the work that I've been doing, and the people I have been mentored, the people, my mentors have worked who have like 35, 50 plus case reports, they'll tell you that the most important reason why most case reports get rejected are because the laboratory or the imaging findings are inadequate. But inadequate means that they are not making sense. A lot of the times we send up blood work, we send up CBC profiles, and those don't turn out to be normal. This could be due to a human error made by the person who is taking the blood, or it could be due to the maybe a machine error. It could be anything. But it is very important to make sure that whatever blood work and CBC profile is being done by an adequate source. We know I don't know if what happens in Karachi, but from what I know, in Lahore there are major banks in terms of, I think Afan is a very good laboratory center. Shaukat Khanam is a very good laboratory center. We've got Chughtai. So there are different labs that you could use that are kind of proven, and that also plays a very significant role, because at times a case report, the one who is reviewing the case report sees that the laboratory findings that they have presented are from a lab that already is considered a good lab, because they have already accepted a lot of case reports that have presented with the same laboratory. So there's certain insights that I'm giving you regarding case reports while you are publishing them. So for this patient specifically, we can see the initial CBC that was taken on 7 March 2025. They had normochromic normocytic anemia, pancytopenia, and severe leukopenia. The hemoglobin, it was 5.6, and RBCs were 2.28 into 10 by 6. Platelets were 14, which is kind of high, and 0.9 to 10 was the TLC, total leukocyte count. Follow-up CBC that was taken a day, the next day, and then 2 days prior, from 8th, 10th, and 12th March, we can see after the transfusion was done, showed the persistent pancytopenia that was being occurring. That shows that there was slight improvement due to the post-transfusion. We also have to take into account other tests. Mostly there are rejections due to the amount of tests that are being done. At times, we know in Pakistani hospitals, specifically in the government sector, a lot of tests are being prolonged or they are being delayed due to the lack of cost the patient cannot afford, or at times because due to a delay of load shedding or a lot of stuff. That also plays a significant role in getting adequate findings that are required. So we can see ultrasound, there was mild hepatomegaly in the normal abdomen. Then we have got LFTs, which were kind of normal. CRB, which was elevated at 170 milligram per deciliter, which is way higher which is should be way less than 5, but it's way higher than the normal. We can see the electrolytes. There was slight hyponatremia. We can see there was reduced sodium count, and hypokalemia, reduced potassium count as well. As the bone marrow biopsy suggests, there was confirmed diagnosis of aplastic anemia. And even the echocardiogram shows that the left ventricular size function was normal. So right now, you all can understand that this specific case is moving towards aplastic anemia. But gradually, in the next few slides, you'll understand why this would be a viable case for a case report. So now, what was the diagnosis and the complications? So the primary diagnosis that we end up writing in the case report comes up from the major physician who is handling the entire case. So for example, this case was being handled by the doctor, major doctor, the physician who clearly made the primary diagnosis as aplastic anemia based on the bone marrow biopsy and the CBC finding. Also, the associate complications that we're seeing were right ear gangrene with perigonditis, clinical suspicion supported by the ENT referral. So we can see the second referral was being made to the ENT department, who made sure that the ear and the eye that were being taken into account play a significant role in ensuring that. Also, the hearing loss also indicated that the ENT evaluation was being requested. Now, the current treatment and management. This is the part where the case report is the real challenge. A lot of the people don't know how to, how to translate the treatment and management plan that really happened in the hospital onto the piece of paper or onto the manuscript, and therefore they end up struggling with how to report the case. So, for example, I was treating a patient. The patient had jaundice. For that patient, I prepared an entire treatment plan. The treatment plan was executed, it was being managed, and the patient became fine and they went back home. Now that was being done. But how can I put that entire thing onto a piece of manuscript is the real art of case report writing. Initially, a lot of people struggle with that, but with time, you can get better. I've a big suggestion from my side is that one should avoid use of ChatGPT or DeepSeek or any other chatbot in this, because what usually happens is that, considering this is something of a narrative writing, you know the case yourself, you saw it, you have understood it, the physician was right there with the patient. So rather than trusting AI with everything, I think it's better to write it yourself. What you could do possibly do is, this is what my suggestion is, that you could write a treatment plan. For example, in this case, we had the supportive care. The blood transfusion was done to manage anemia. Medications were administered, maybe the injection, Tanzo injection, linzolide, Provas on set, and then the tablet folic acid was given. Injection of meropenem was given. Also, the specialist referral, which was the ENT consultation of the right ear gangrene, perigonditis, and hearing loss, was also being made. So this was the supportive care. What I could do is I could write this entire thing in a paragraph in a narrative form, and then I could improve that specific text to a chatbot. But the major suggestion is write it whatever the way it happened in a narrative way, because at the end of the day, a case report is explaining the world how this case was being treated, how it was managed. Now, this is where case report plays a very important role. What is a discussion and what are the learning points? So, whenever we report a case, we are reporting it because we think that this case is unique to the world. This doesn't happen often, and if we report it, we can add it to the literature that exists. So, if today we open books and we go through certain diseases, those diseases were case reports initially. These were cases that were being observed around the world. They were being reported, and considering they were information to the literature, they were added to different books, different articles, different journals. Similarly, today, if you end up finding a rare case and you end up reporting it, tomorrow it might be part of a book and a disease might be mentioned like that. All right. So, what is discussion? Discussion is in which you compare how the initial existing literature is different to your case. I am going to give you an example other than this. Is, for example, a person presents with vitamin B12 deficiency and has several complications and also has sort of brain hemorrhage. So, and is presenting with a post complaint of brain hemorrhage or anything internal bleeding in the brain. Now, a lot of people would be like, how can this correlate? And that is what makes my case unique. When I will be writing the discussion for it or the learning points, I would be comparing all the past literature that is with vitamin B12 patients and telling how my case is different to it. You get me? It's a comparative paragraph that in which you compare what already has happened with what you are adding to what exists. So, for example, in this specific case, the case significance shows that highlights the complexity of managing aplastic anemia in pediatric patients, underlining the importance of prompt intervention in cases with bleeding and signs of infection. Differential diagnosis that is being considered, we can see how other causes of pancytopenia and coagulopathy plays a significant role. Then there are certain clinical pearls that we could take into account, like timely lab work and imaging were critical for establishing the diagnosis. Multidisciplinary approach was important in ensuring that we get all the different aspects such as hematology, ENT involved in this entire specific case in managing, and also the complications that were addressed. For example, for further research, we also add. So in discussion, as I told you, first thing is that I can in this we usually write the citations. In the next few slides, I'll tell you how to write a case report. Then I'll talk more about it. But what do you usually do? That for this specific case, if we take the example, I'm going to go on the internet and search about all the existing information regarding aplastic anemia in pediatric patients. All right. I'm going to go through that information. I'm going to filter that information and I'm going to place it. Then I'm going to write about how my patient was different to them. All right. And in the end, I'm going to tell what were the major considerations that we made and what are the limitations and what are the further questions that we could ask that could answer the future researchers. This also, just for example, in this case, optimal timing for transfusion and antibiotic therapy in aplastic anemia is a question. Like in the future, if we do further timely intervention of transfusion and antibiotic therapy, how much it can help in managing aplastic patient. Also the long term outcomes of how pediatric aplastic anemia and concurrent local infection play a significant role. So these are future questions. All right. Next up, this is what is I can say a summary of whatever I've read up till now. What or how can we go about on writing a case report? So, look, the thing is that firstly, you end up finding a title. Title needs to be, it couldn't be just, it could just not be the name of a disease with this, that. It could be, but usually we tend to write a title that is, that makes the case report look more and more unique, more and more innovative, and more different. For example, a patient presents with 7 testes. Again, I'm just saying something completely random. It might not even be possible, but I am just saying it. All right. So what your title wouldn't be case report. Title wouldn't be a patient with 7 testes presented in the hospital in Lahore. It would not be like that. It would be a very different title. It would be 7 testicular patient with this specific disease in this area. All right. So your case report title needs to be very concise and informative. It should involve the unique aspect of why your case report is different. All right. Then is the abstract. Abstract needs to be written in the end when you have already done the entire case report, the introduction, the description, the discussion, the conclusion. Then you come up to the abstract is a small summary of everything, and you just write it in the end, just a small summary of everything. You just place it in a couple of paragraphs. Then it's the introduction. So as I initially stated, what is introduction? Introduction is the explanation of the relevance of the case and why is it unique. So in this, you just give a brief introduction of how this it was happening. For example, in this specific case of aplastic anemia, if I ended up writing introduction, I will be initially going towards all the aplastic anemia previous cases. I'm going to tell how this case is important and relevant to this day and age, how it's relevant to pediatric patients, how much is its prevalence in Pakistan and abroad, how much is its prevalence in younger kids and specifically women, and also women who are also have presenting complaints with ear and nose, ear and eye. So these are the things that I have to write, and however, and then I will tell why my patient was unique compared to them. Then is the case description. Here you will add up all the things that I initially told, which is the patient demographics, where they were from, the entire history, the clinical presentation, the detailed account of examination, lab test, imaging. Here it is very important to attach the right set of imaging, the right set of lab test. This is where I was initially talking about. You have to be very precise, very concise, and very good with the data collection, because if your data lacks any of the major things that are required for that specific case, then it might be rejected. An example of that is a patient who wants to do a case report of, for example, neurosurgery. All right, and he doesn't even have an MRI to add to the case report. Then the case report has zero chance of being accepted, because if you don't have CT scans and MRI of the patient's brain, how can you end up and making a case report out of it? So therefore, it is very important to get the right lab test and the imaging, because that plays a very significant role. And even the clinical presentation needs to be very exact. A slight contradiction, for example, at one point in your description, you are telling that the patient was 25 year old. At the same time, you were telling that patient had like, for example, a disease that is only prevalent in old people. So this could be a contradiction. So you have to be very precise. You have to read what you are writing. Just don't chat GPT through it. I'm again telling you, it is the reason of a lot of rejection these days, because people just don't know. They are just continuously using chatbots. Discussion, I initially told what discussion is. Discussion is just comparing the literature, what exactly was previously there. You will tell how my case was different, my management was different, and how can we do this better in the future. And conclusion is just summarizing the clinical insight and implication of the practice. In conclusion, you can usually write what the physician had to say after the case, what you believe makes this case and extra information for the world, and how it could become important for future doctors to look back. For example, a lot of times when doctors have to perform a specific surgery, they go through different case reports. Why? Because they see that if this case has been reported before, and if it is reported before, or if something similar is reported before, how was the management being done, how was the treatment being done. So therefore, you have to explain in a conclusion how can this specific case help future doctors in the future. In the end, you have to add the references. You have to cite all the relevant studies and guidelines. Usually it is done according to Harvard style, which is a specific thing that you might learn in other workshop or seminar, but it is not hard. You can YouTube as well. But that is what is usually done for most journals in case reports. But again, you have to first see the target journal that you are targeting, and you have to do accordingly. The journal tips, as I initially stated: organize the report in a logical sequence. Visual aids need to be made. Charts, lab graphics, imaging snapshots to illustrate finding. Focus discussion. Discussion should be very, very important. It is highlighting the key teaching points and controversies. The audience engagement needs to be very important. Make the case report uh, in a way that it poses questions, it encourages discussion on management challenges, and also proofread. Try to ensure accuracy and clarity in every detail. You can proofread in a way. You can proofread through the internet by putting it through different paraphrasing tools, in which, for example, Quillbolt, and then you've got Grammarly, could ensure that if there is a spelling error or a grammar error, you can go through that. You can ask your friend to proofread it, or your physician to proofread it, or attending. So that just helps you to have another eye on your entire manuscript. That helps you to have a better case report. In the end, I think that was it. In this case, entire session, I tried to not only give you an idea of how a case report works, but also try to ensure this specific case, how can this specific case be addressed in a form of case report. So yes, the floor is open to questions, and I'll be really glad if I get first some feedback from all of you, and then we can move to questions. So yes.
Thank you, Daim, for this insightful presentation. Now we will be moving to the question and answer segment. If anyone have any question, you can unmute yourself and ask directly, or you can drop your questions down in the chat box. So Maheen is asking, so how to basically get a case?
Question, which means that is it necessary to find a case in order to proceed with a case report? So yes, what you unlike what we could do with meta-analysis or systematic review, or we could do in original studies such as cohort studies or cross-section studies, case reports require you to have a case. It is not something that you could just sit and randomly go through PubMed or Google Scholar or Cochrane or Medline and end up doing. You need to have a case that you have to present. So it comes up with certain restrictions or limitations, but at the end of the day, it's kind of easier compared to a lot of other studies that require a lot of documentation and a lot of uh, time to in order to complete them. Case reports are usually easier compared to others. So another question that I got was, my question, which case report is eligible for writing case report? Matlab, how would we know? Yeah, so answering Sania's question, we have to take into account, we have to first consult the doctor that we are with or the attending who is managing the case at the point of time. So if they believe that the case is unique enough or viable enough, then it just doesn't mean that you go back and just start writing a case report. You have to do a literature review. What is a literature review? For those who know, I think they would understand by now. The ones who don't know, literature review is going through the internet. By internet, I mean there are three, four major search engines that you could go find articles, already existing case reports, meta-analysis, systematic reviews, all the different types of researches. The first one is PubMed. You guys might have known by that. Then you've got Google Scholar, you've got Cochrane Library, you've got Medline, and you've got Scopus. There are others as well, but these are the major ones. Go there, make a search strategy of the topic or the case report that you're looking for. Once you'll do that, you will come across different case reports. You will see, if you don't have a case report in the world that exists like your case, proceed with it. Even if there is a case report that is similar to your case but took place in, for example, Africa, or took place in the United States, or took place in Canada, or took place in United Kingdom, you can still go about it, because at the end of the day, uniqueness is not limited to being the only one in the world. It is also limited to demographics. If your case report is unique to Pakistan and there are only few cases in Pakistan, yet your case report is unique. Get me? But if your case is prevalent, if something is happening continuously in your hospital and it is already being reported, there is no point of reporting it. I think that answers Sania's question. Next up, we have got Fatma's question, which is, do you need to involve the doctor that diagnosed the disease if, let's say, you have a case from your family and patient consents to being published and your yes. So consent is something that I missed in my presentation. I wanted to really address that. Consent is very important. Patient's consent is the utmost priority. Next major consent is from the doctor itself. Considering, you have to realize that you are not fixing these patients in your home, you are fixing them at a hospital or a clinical setting. So whenever you are doing that, your hospital or clinical setting needs to be something established. It shouldn't be something that is inadequate, because what happens is that journals usually tend to reject articles that are from hospitals who have kind of a reputation of manipulating data. So just realize, if you realize that, it is important to get the doctor on board. If you think the doctor is trying to get a publication out of you, or was pushing you कि मैं तो first author बनूंगा और आप लोगों को मैं करने ही दूंगा कुछ blah blah blah, then escape from that. However, what you could do is कि आप उनको बता दो कि sir, I like the case, I really want to proceed with it. If you can help me get the data, then please go ahead with it. वो mostly होता है ये कि doctors को क्या जा रहा है, उनका कुछ नहीं जा रहा. If they want to, they help you and they will allow you to do. तो आप जाके डेटा कलेक्ट कर सकते हो हॉस्पिटल से, और जब आप कर लेते हो हॉस्पिटल से डेटा कलेक्ट और पेशेंट का डेटा, पेशेंट से कंसेंट ले लेते हो, देन यू कैन प्रोसीड विद द केस रिपोर्ट. ओके, बट डॉक्टर को इन्वॉल्व करना पड़ता है. यू कैन नॉट go ahead without doctor's approval, because it's just like someone's intellectual property. आपने किसी ने काम किया किसी केस के ऊपर और आप उससे पूछे बगैर ही केस आप रिपोर्ट कर दो. So that's wrong. Then if we've got Lisha's question, if the journal hasn't specified if they require a structured abstract or not, what's the best approach to the abstract of a case report? Usually there are guidelines. I think 90% of the journals I know have guidelines. But if it doesn't work, what you could do is you could just use the guidelines that are set for some other journal and try to do for that. In case your case report gets rejected initially, they will tell you what's the right guideline, and then you can follow it and do and get it accepted in the second time. Then we got Hiba's question, which says, should radiological reports be uploaded as soft copies from the labs, or can we attach scans which we have taken pictures of? Yes, so usually it shouldn't be soft copy. It should be like soft copies that needs to be uploaded. However, what happens is we know how Pakistan works, how government hospital works, and how usually hospitals operate. It's very hard to get the soft copies from the labs, because there needs to be certain copies that need to be in the file as well of the patient, that needs to be kept in the records. So it's important that you get pictures, but the pictures need to be very clear. Pictures need to be very precise. If you feel like the pictures are non adequate, then you have to go back to the hospital and get the right copies and then upload them, because as I told you, imaging is important. Imaging shouldn't be inadequate. Okay, so what if there is no treatment? So no worries, if there is no treatment, you can clearly write in the discussion that the treatment was suboptimal. They tried different things, because every time a patient comes, there is certain things that we try. So you can mention them, but it's not necessary that there is a treatment of all everything in this world. We are still yet to treat cancer properly and a lot of other stuff. So therefore, it's completely fine. You have to just explain why it is but why it's hard to get it. Okay, so Araj has a question. Is it necessary to submit a written patient consent form for journal submission? Yes. So what usually happens is, whenever you are submitting a patient's consent form, it needs to be on the hospital letterhead. By what I mean by hospital letterhead, it means that the patient who was being checked in, for example, Liaquat National Hospital or Civil National Hospital. I'm taking Karachi's context because I don't know much, but I know kind of about somewhat, or Aga Khan Hospital. So in that specific hospital where the patient was present, what you need to do is you need to get the consent form right there and then. That consent form picture would be uploaded and submitted with the case report. If I have if I could share a couple of case reports of mine with the data later on, I think Zainab would share it in your groups. That would give you a better understanding of whatever I said. So you can just see an example of how a case report is being done. And I think that will be really helpful for you, because that would not only have all the data of the case that would be collected and what was the end result, the case report that he published. So I think that answers Araj's question and Araj's question. And next up, we have got Sania, who says, okay, so what if the person ended up dying before the surgery has been established or treatment of one? Again, as I said, you still have to report the case, because what happens in the case report is that you're reporting a significant change or a unique aspect of clinical setting. It doesn't need to be something that ended up being treated. I have a case report that is from the United States of America, from Pennsylvania, in which a patient has hemophagocytic lymphohistiocytosis in a 70-year-old patient. Now that patient died, but that specific thing in a 70-year-old patient is impossible, next to impossible. The doctors there could not imagine it, but that happened. So what happens is that your case needs to be unique. The symptoms, the signs, the treatment, it could all be variable, but what matters is the patient could die, they could stay alive. What matters is, if it's unique, report it. So that's the way of going about it. So I think that those are the questions that I found. If anyone has any other questions, they can write it, or they could open the mic and go ahead with it. I would love to get your feedback, like at least three to four people's feedback out of this, because that would really help me improve uh, in future sessions, or would also love to know what you guys understood or anything you would like me to add. Okay, so Sani has asked another question, which is, should we also address the next step, like as it was in today's case, ENT aspect? Yes, we, as I said in the conclusion, you also talk about future researches, what further could be done, and what could happen in the future. Like for example, in this case of aplastic anemia in pediatric patients, you could suggest a future plan of how we could do multiple transfusion early on, as soon as the patient alive, rather than waiting. So how could that impact? So yeah, remember, this is something that I usually tend to explain people who are into research, or who are starting research, or who are even in research for a while. It is easy to get publications, a lot of them, but it's harder to be curious and understand and explain why research was important in the first place. Today, if I am in my classroom alongside five of my classmates, and I feel like a lot of my classmates are getting acne today, all right, what I could do is I have a question. Why are a lot of them getting acne? And if they are getting acne, surely other medical students who are going through stress, who are going through sleepless nights, who are going through a lot of caffeine, they surely might also have going through this. This is a question that came towards me. It's a curiosity question. How can I go about research from this? Is I could go back to a literature review, the way I initially told you, go through PubMed, Google Scholar, and all those platforms, research about it. If you cannot find a research that addresses medical students or young teenagers or oh, sorry, young adolescents or young adults like 19 to 25-year-olds, then and if even if it's there, if it's not done in Pakistan or if it's not done in Karachi, if it's done only in Lahore, you could address that. That's a gap needs to be filled, so then you can go about and do a research in that. Similarly, when someone wants to do meta-analysis or systematic review, what they do is they go through already existing controlled trials or randomized controlled trials, RCTs, and they see what could be a correlation that we can find. We have three RCTs that tell that if a patient is being given midazolam rather than diazepam, what is the difference that is happening towards their kidneys. All right, so these are different control trials. They'll find 5 6 control trials, and then they will try to put them together and try to analyze them and come up with a conclusion. So at the end of the day, research is always about finding what is already there, but making sure what we could add on to it. So case report is just another aspect of that. So yeah, I think that was from my side. I am open to more questions, and I would also want feedback, please. uh,
Uh,
that is
so we do
that
have a feedback form that will be shared in the group, and we'll be sharing the responses with you. So don't worry about the feedback. Like we have the form ready.
All right, all right. Thank you so much. I just wanted to get it out of the. Anyways, if you guys have any questions, I would love to address them, even if they are not regarding case reports. If they are regarding this specific case in general, if you want to ask, you can go proceed with it. What if it's a rare case but has same presentation as already published case report? You will write it as a case report. Okay, so if you are talking about a rare case but in the same hospital in like last year, then there's no point of writing it. But yes, if the case there is a rare case, for example, a patient with a certain eye ophthalmology problem, and it is very rare, it happens like one in like 10 25 years, then you can still go for it. Even if civil hospital has reported three cases up till now, one was in 1980s, one was in 2000s, and now you report it, it's still viable. But again, what is different this time around in the presentation would be different because back then there was lack of imaging, lack of scanning, lack of a lot of stuff that you could do today. So you could do the same case, but after a lot of years in the same hospital, but it needs to be different in any way or form. It's up to you. I think it's when someone is writing, right, they know what they could, how can they make it unique, because at the end of the day it's more about how you present the case rather than what the case was exactly about. बट मेक श्योर ऐसा भी ना हो कि बहुत से लोग इस तरह भी करते हैं कि केस बहुत बेसिक होता है और वो उसको यूनिक बनाने के चक्कर में उसमें झूठ डालते जाते हैं। और याद रखना, द वन हु इज रिव्यूइंग इट, द वन हु इज गोइंग थ्रू इट, वो बच्चा नहीं है। उसने उसका काम ही ये है, दे आर पेड बाय द जर्नल, कि आपने रिव्यू कर रहे हैं तो वो पैसे लेता है इस काम के, तो उसको पता है कि कौन सा है। उसको रिजेक्ट करने से कुछ नहीं जाएगा, वो आराम से रिजेक्ट कर देगा। और फिर आपका दुख ज्यादा इस बात पे होगा कि अगर आपकी देखो ना, अगर आपकी रिजेक्शन इस बात पे आती है कि आपने कोई गलती कर दी लिटरेचर की, या आपने गलती कर दी डिस्कशन में ऊपर नीचे कुछ चीजें लिख दी, तो आप ठीक करके फिर से सबमिट करा सकते हो। बट अगर आपकी पूरी केस ही बहुत ज्यादा रेयर था ही नहीं और आप उसको फजूल में ओखा कर रहे थे, तो वो उससे होगा ये कि आपका केस रिजेक्ट हो जाएगा और फिर आपको पूरा लिखना पड़ेगा या आपको पूरा केस ही रिजेक्ट करना पड़ेगा साथ में। इसलिए बेहतर ये है, दिस इज व्हाट आई से, एज वी से प्रिवेंशन इज बेटर देन क्योर। इट्स आल्सो इम्पोर्टेंट कि लिटरेचर अच्छी सर्च करो, पहले से देख लो करता है एग्जिस्ट कि नहीं। अगर नहीं करता, गो अहेड विद इट। ठीक है। एंड अगेन आई एम टेलिंग यू, पाकिस्तान में वी आर सो ब्लेस्ड, वी डोंट हैव टू गो थ्रू अ लॉट ऑफ लॉ सूट्स एंड स्टफ। हमारे यहाँ इतना पेपर वर्क नहीं है। Why do you think we guys end up doing a lot of case reports unlike the West? The reason is West में पेशेंट देते नहीं अपना डेटा, वो कंसेंट नहीं देते, तो फिर आपके बहुत से अंडर रिपोर्टेड रहते हैं केसेस। हमारे यहाँ पे पेशेंट्स डोंट माइंड। आप उनको कहोगे कि अम्मा जी, या आप देखें आपके साथ ये आपका केस था, आप उनके फैमिली से ले लो कंसेंट और हमें उसमें से ये चीज़ें होंगी, आप हेल्प करेंगी, मेडिकल साइंसेस को हेल्प होगी, तो वो दे देंगे आपको ज़्यादा, और उससे आप ऐड कर सकते हो। इसलिए इट्स इम्पॉर्टेंट। What do you think beginners should start with as far as research is concerned? This is my personal opinion. I think if you are in final or fourth year or house job, you can do case reports. There are at times you can find a case, but if not, I think again, this is a personal opinion, but I think you should go about if you want to do USMLE, or if you are looking for that pathway, go for meta-analysis and systematic review. Take a couple of workshops, try to dissect it well, understand it well, practice. Maybe the maybe it become 10th author in the first publication, but learn. I myself, in this journey for the past 3 years, I have gone through times when I have worked for a lot of people, and I ended up getting like no publication at all. Like they betrayed me. So this is something that also happens in this entire field. So don't be disheartened. Just remember कि आपने कुछ सीखा उसमें से, एंड कल को जब आप उस पोजीशन में आ जाओगे कि आप खुद अकेले लिख सकते हो सारा कुछ, तो फिर आपको जरूरत नहीं पड़नी किसी। सो इस तरह ही होता है कि जस्ट ट्राई टू टेक पार्ट इज एज मेनी प्रोजेक्ट्स एज पॉसिबल। ऐसा भी ना हो कि 10 ले लो, 2-3 लो, आहिस्ता आहिस्ता करते रहो 6-7 मंथ्स में, और जब आप कुछ ना कुछ सीख लोगे देन यू कैन मूव आउट। मेटा एनालिसिस सिस्टमैटिक, इफ यू आर यूएसएमसी स्टूडेंट, अगर आपने पाकिस्तान में रहना है और अभी आप फर्स्ट सेकंड ईयर में हो, देन गो फॉर ओरिजिनल रिपोर्ट लाइक क्रॉस सेक्शनल या कोहॉर्ट। ठीक है, आई इनिशियली टोल्ड यू अबाउट क्रॉस सेक्शन कैसे करते हैं, वो एक्टिंग वाला एग्जांपल देके। Okay. Can we still go through with a certain case report if an important test was not done due to lack of resources? Yes. So you can explain that in discussion, and you could also, that also makes a case report unique, because sometimes cases are reported in a very low tertiary care, not tertiary care, low peri-urban hospital, which has a very, that has very less resources. So what you could tell is that if we had resources, we could have done this better and this better. You could write that in discussion, but at least you should have certain set of tests that needs to be done. For example, if you have a case of TB, PPD test needs to be done. Without PPD test, you cannot just say that this patient had TB. All right. So the major gold standard test needs to be done to determine the case. However, if you don't have extra tests to confirm the diagnosis, you can still go about it. But as I said, always have the doctor who was doing this entire time with you, because they could give you a better understanding. I'm not sure if any one of you is already a doctor, but if you are not, you would be one soon. So you know, the one who is a house officer have a better understanding of everything. Thank you for an information. Good for documenting extension investigation should we include? Yes. So if I can share my screen again, and as you guys can see here, we have got a case that I worked on, which was Whitaker syndrome, a case report of autoimmune polyendocrine syndrome dilated syndrome type 1 with dilated cardiomyopathy. So this specific case was very rare. It presented in Lahore General Hospital, which is the second largest government hospital in Lahore, located on the main Firozpur Road. Just like you guys have Shara FSL, so Firozpur Road is the main one. So therefore, a lot of patients come every day, and there was a report, and Dr. Ali Gaur, who was the attending at the time, he presented. He had three major PGs working with him, and they wanted to work alongside. So what usually happens is that if I open that, you can clearly see the kind of images that were being attached. All the figures were being placed. You get me? You can see the different figures that we have added. The CT scan was being placed. The chest X-ray was also being added. The figures, all right? And even if it's not there, you can also see other things. The abstract, you can see, abstract is just an entire uh, summary of everything. So I have opened the DOI here of this case report. So here is the entire case report. Here is the introduction. Now in the introduction, you can clearly see that there is a one. This is a citation, by the way. For the ones who are completely beginners, this is citation. 1, 2, 3. You can see 2 here, 3 here. Citations are where did you get this information from? So APS1 is a rare autosomal recessive disorder affecting approximately 10 per million individuals. All right. So this was information. I got this from a specific. I click on this one, and you can see, and you can clearly see that how this is the specific this specific article is the one they extracted this information from. So your introduction is usually about the entire study in itself. So you can clearly see how the presence of one out of the triad plays a significant role in this. All right. Next up, you can clearly see the rest of the introduction that we have got here, and how we have got different set of citations and different set of information we collected about the case. Here is the case history. You can see we have written the case history in a way that it explains the case. 28-year-old male patient came with foot swelling for 3 months. At the age of 7, he developed, this is the history of the patient. 7, he developed alopecia, loss of eyebrows, along with peripheral tingling and stuff. Then you go downwards, you can see we have attached an image to show the what exactly was going through, right? You have to just, it's just a summary of what happened with the patient. Then this is the real part, differential diagnosis. So differential diagnosis clearly stated that how this entire thing happens, how the EEG goes about, the epileptic activity, the MRI of the brain, the basal ganglia clarification, and all of this stuff. We explained it here. And then most importantly, we had the CT scan of the brain here. And here it is something that I also wanted to mention, the tables. So sometimes you cannot just upload the entire CBC report. You have to make tables. The tables will involve the things that were required. So for example, here we do an echocardiography and all the things that were being mentioned, they try to make a table out of it and they uploaded the table here, right? So this is how you report different cases. And then you add the figure of the X-ray as well. And it's just not like you just add them. You write their reason why you are adding them in the discussions. For example, if I am talking about, we also did an chest X-ray of the patient and we found this findings, I will add the figure of the chest X-ray. If I'm not discussing that specific thing, I would not mention it. I would not add the picture of it. If you get my point. And this is the outcome and the follow-up. As the initially there were questions about if the patient dies or if the patient does not, we don't have resources to fix him and stuff, we refer him to another hospital. Just write it here. All right, just write it here. For example, in this, the patient symptoms were improved during the hospital stay, but he was asked for a follow-up in the outpatient clinic with a fresh echocardiogram, chest X-ray. On follow-up after 3 months, his symptoms were settled and calcium and hemoglobin profiles were improved. Okay. And in the end, this is the discussion. An example of the discussion is right here. Up now look, the clinical presentation of APS often begins. This often means that usually हमने as a tell हमने ना comparison करना है यहाँ पे. पहले क्या होता है, usually जब होता है early childhood में होती है और complete manifestation आती है classic triad में 2 decades of life में. ठीक है, अब देखो उन्होंने सारा बताया, तो सारा बताया कि यूजुअली क्या होता है, व्हाट इज द नॉर्म. अब बताना है कि व्हाट इज आवर पेशेंट डूइंग, कंपैरिजन. आवर पेशेंट क्लिनिकल प्रेजेंटेशन likely stems from the underlying pathophysiology of APS1. The hypocalcemia and the seizures are due to the autoimmune hypoparathyroidism, while the generalized alopecia and nail dystrophy and the mucocutaneous candidiasis resulted from immune-mediated destruction of the hair follicles and chronic fungal infections. So we explained why our patient was different, and the further thing discussion is also based upon that. ठीक है, देखो इधर साइटेशन की हुई है, मतलब पुराना टेक्स्ट दिया हुआ है जो कि इन्फॉर्मेशन ऑन द इंटरनेट, और बताया हुआ है हाउएवर हमारा जो एपीएस था वो इस तरह का था, हाउएवर हमारा तो ऐसा था. You get me? You have to explain why your case is better, justify it. Conclusion में there is nothing as I told you, unique clusters of clinical manifestation, especially इस तरह करके होते हैं Whittaker syndrome के hallmarks. Significant cardiac compromise होते हैं usually, but बताया कि हमने multidisciplinary consultation is the only way forward कि हम different सारे departments को साथ लेके चल करें. एंड पे आपको ऑथर कंट्रीब्यूशन लिखनी होती है. दिस इज समथिंग जो कि जिसके पे आप काम कर लो बता देगा. देयर आर डिफरेंट थिंग्स दैट यू एंड अप डूइंग. एंड then we have got acknowledgements, funding information. Usually we all do our work. We don't have grants in Pakistan like people pay you to do this, but if you does तो आप ये लिख सकते हो. conflict of interest में आप लिखते हो कि if the authors had a conflict of interest on certain stuff you can write it. ethics statement आप लिख सकते हो. इसमें usually आप अपलोड करते हो, यहाँ लिखा नहीं हुआ क्योंकि वो किसी का कंसेंट फॉर्म तो नहीं दिखाएंगे ना सबको, लेकिन हम जब सबमिट करा रहे होते हैं केस रिपोर्ट तो हम दिखाते हैं, हमको रिटन इन्फॉर्म्ड कंसेंट दिखाते अपलोड करते हैं टू पब्लिश द केस रिपोर्ट. एंड दीज आर द रेफरेंसेस जो भी हमने साइटेशंस की हैं, और ये सारी ओपन रिसर्च है कि अगर हमें फ्यूचर में इसमें डेटा चाहिए हम ले सकते हैं. सो दैट वाज एन एग्जांपल ऑफ एवरीथिंग. आई थिंक दैट आंसर्स अ लॉट ऑफ योर क्वेश्चंस.
So we are approaching the iftar timing, so let's wrap it up the session over here. Thank you so much, time for this insightful session and the audience for being so interactive. Thank you again. See you in the next session. Thank you so much joining everyone.
Thank you so much for having me, and yes, good luck, and inshallah see you guys soon. Allah Hafiz.
Also, Daim, if anyone has any other questions for you, I'll share them with you and then you can answer them and I'll convey your answers to them. Thank you so much for your time. It was a really wonderful session.